Hi, I'm Dr. Jeffrey McLean, Assistant Professor of Neurology at Uniformed Services University at San Antonio Military Medical Center, and I'm joined today by Dr. Joseph Servin, Chair and Professor of Neurology at Mayo Clinic, Scottsdale. Thank you for joining us today.
It's a pleasure to be here.
So, Dr. Servin, you're an expert, well known for your work in epilepsy. I thought I'd just start off by asking you what brought you to the field of epilepsy to begin with.
Sure. A lot of different things brought me to the field, but I think it was like when I was doing a neurology residency. And what I remember most is at that time, it seemed like we had a lot of potential options to help patients with epilepsy. And that sort of spoke to me in terms of trying to kind of pursue that as a field, because I just saw that as both fascinating from a clinical standpoint, but also from a therapeutic standpoint, because there's so many different options, surgical and medical. And I think that's kind of what directed me in that field.
Sure. And with all those options, there's so many choices for medications. I think a lot of patients wonder, how do you choose as a physician which medication to try with a patient?
That's one of the toughest questions, because there's not a given one answer that fits to the patient. Because there's almost more than 20 medications that's available, the way to make a decision for a patient is to listen carefully to the patient's seizure type, what adverse effects or other comorbid conditions they have, and then try to kind of navigate a pathway across the different medications to see what fits. If there's more than one medication that's appropriate, then what works for that person given the side effect profile? Or maybe it gets down to finances. What is the best option that we can use given what's available to us? And that takes us a little bit of time, but it's somewhat individualized for each person depending on what's happening and what their profile is in terms of the type of seizures they have and the complications they have from it.
So would it be fair to say that with many patients it takes multiple attempts before finding the right regimen, the right drug, or the right combination of drugs that works best for that patient?
Even in 2015, the sad reality is that there's still some trial and error that occurs. So oftentimes you will start on initial medication, you cross your fingers, hope that's going to work out, but sometimes it doesn't, and you have to go to something else. The key is the more information we have of the patient, the more we can break up this large group of drugs into categories, the better shot we have of picking just the right one that's going to work.
With all the new medications that have become available recently, what should patients be most excited about that's become available?
Well, there's a few trends that's occurred of the newly available medications. Most of them are fewer doses over the course of a day. That's a big issue because individuals with epilepsy often have memory problems. So a lot of the newer medications have maybe once a day or twice a day dosing, which helps with compliance. Other options are available with regards to new mechanisms of action for these medications. We have a few drugs that have emerged that they're the first of their type in mechanism of action. That's exciting for two reasons. It's a new way of approaching the diagnosis and treating it, and it might open the doorway to combining drugs with different mechanisms of action to get one simple additive effect, like what happens in cancer treatment or infectious disease treatment. So those are the big items that's emerged that can be really helpful.
And how should patients go about talking to their physicians about whether or not they should change to one of these new drugs or try one of these new drugs?
I think what I would tell patients, it's what I tell all of mine, is I ask them to do their own research. Google medications, go to websites, trusted websites, and try looking at what those options are, and come to me with regards to questions you may have. One of the things that's clearly there is that information is available from so many different dimensions that if patients are empowered with that information, they're more likely to get a better result, in my opinion, because they know what's out there and the neurologist can talk to them and perhaps guide and offer their expertise, if you will, to see how we can best improve quality of life for these people.
One thing that's been in the news a lot as far as treatment for epilepsy is marijuana.
Sure.
What are your thoughts on that?
Well, my sense about cannabis or marijuana is that it's one of those things that truly needs to be evaluated. There's so much hype, both positive and negative, that the only way we'll ever find the truth is by decent research. Cannabis has so many different compounds in it. It's a matter of picking out what really is going to help and trying to get rid of that hype and try to understand, is this really going to be useful? Is this going to last in our conversation about epilepsy in the future? Or is this a fad? And I think the more we do the research, the more we try to understand that and study it, just like any other compound, the better that we'll be.
Well, you speak about the importance of research. What research are you excited about as far as what's coming over the horizon in the next couple of years for epilepsy patients?
There's a few areas of research that are very exciting. A couple of them are the fact that there are different approaches to treating epilepsy. There are the idea or the concept of using anti-inflammatory agents to treat epilepsy, which is something that was unheard of. Other areas of research are just the huge array of devices that are available not only to detect seizures, diagnose seizures, but perhaps even to manage them either both within the brain or externally driven. Other areas, and I think that it's somewhat new for our field, is that there's a big emphasis on seizure emergencies. And there are a whole host of products in development that helps to bring the typical treatment for those emergencies, which is a benzodiazepine is a fancy name, but it can be Ativan, Valium, other medications, and delivered either in an inhaler or a dissolving pill that can be put on the cheek, or even like the EpiPen, an auto-injector that you just place immediately into someone's leg or arm to stop the seizure emergently without having to use an IV or have to call an ambulance. These are huge changes, both from a society standpoint and a medical standpoint in terms of how we view these things, so that patients can really get that quality of life control back so they can go on. And this is more of a hurdle as opposed to an obstacle.
Right. Okay, great. Well, thank you for taking the time to speak with us today. It's been a pleasure.
It is a pleasure always sitting here to talk to you.
All right, thank you.
You're welcome.